Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about tuberculosis, which is more commonly known as TB. Now, most people in the United States don't think much about TB, but prior to the COVID-19 pandemic, tuberculosis killed more people each year than any other infectious disease. In 2021, SARS-CoV-2, the virus that causes COVID-19, surpassed TB. But it's anticipated that as we get further removed in time from the pandemic, TB will regain its place as the deadliest infectious disease around the globe. Each year, about 10 million people are infected with TB, and about 12 of every 100 of them will die from their infection. That ends up being about 1.2 million people who die annually from tuberculosis. And the most heartbreaking thing about these deaths are that TB is both preventable and curable, so they simply don't have to happen. In the United States, most cases of TB are diagnosed in people who were born outside of the United States. However, it is important to know that cases have been increasing over time, with more than 10,000 cases being diagnosed in the United States in 2024. Death rates in the United States are lower than in other parts of the world. About 5 or 6 people per 100 die from their infection. Despite these lower death rates, that still translates into 500 or 600 people dying every year from tuberculosis in the United States. Now, one reason that people in the United States don't think much about TB is because the TB vaccine is not routinely used in this country. However, the vaccine is used in other countries around the world where TB is more prevalent. It's often referred to as the BCG vaccine, and we'll talk about why that name is given when we discuss the vaccine. Over the next little bit, we'll talk about the disease known as tuberculosis. We'll also talk about the vaccine that prevents it, common questions we get here at the Vaccine Education Center, and we'll consider the relative risks and benefits of this disease and vaccination for the small number of people in the United States who are recommended to get that vaccine. So let's get to it. TB is caused by a bacterium known as Mycobacterium tuberculosis. This is primarily an infection of the lungs. The bacteria are so destructive, in fact, that people with TB often cough up mucus and blood. Children younger than 5 years of age can develop a severe and sometimes fatal form of the disease known as miliary TB. When this version of the disease occurs, the bacteria have actually spread to multiple parts of the body, including the lining of the brain, which is called the meninges. TB is highly contagious, and it's spread through droplets produced when someone coughs, sneezes, talks, or even sings. Many people don't develop symptoms right away after they've been exposed. Instead, the bacteria live without replicating or causing symptoms for years or even decades. When someone's infected with this bacteria but they're not replicating, the person is said to have latent TB. If the bacteria begin to replicate, then the person is considered to have active TB. Now, active TB causes different symptoms depending on the area of the body where the infection occurs. The most common area, of course, as mentioned, is the lungs. And if people have the infection in their lungs, they're going to have symptoms like coughing that can last for weeks and can contain blood or mucus, chest pain, weakness, fatigue, loss of appetite and weight loss, chills, fever, even night sweats. Notably, when children are infected, they tend to have less severe symptoms. So, for example, they might have a prolonged cough, but they don't produce that bloody mucus. Now, other parts of the body that the bacteria can infect include the person's lymph nodes, in which case they would develop hard, painless sores of a red or purplish color under their skin. It can occur in their kidneys, and that could result in blood in their urine. An infection in the lining of the brain can cause meningitis or headache or confusion. An infection in the spine can lead to back pain. And an infection in the voice box can cause hoarseness. Now, anybody can get TB, but there are some groups of people who are at greater risk. The people with the greatest risk of developing active TB are those who are already living with latent TB, meaning that the bacteria are already silently living in them. It's estimated that about 2 billion people around the world are in this situation. Again, that's billion with a B. In the United States, it's estimated that about 13 million people are living with latent TB infections. Now, two other points are important here. Of those people who are currently infected and have a latent infection, some are at greater risk for developing an active infection. And that includes people who are recently infected with the bacteria and people who have weakened immune systems, such as those who have immune-compromising conditions like HIV, diabetes, or cancer, and those who are receiving treatments that weaken their immune systems. Now, the second point here is that not only people infected with the TB bacteria are at increased risk, other people are also at increased risk, including people who are born in a country where large numbers of people are infected with the bacteria, people who live in congregate settings where others are more likely to have TB, such as in homeless shelters or prisons, and people who live with an infected person when that infected person either can't be successfully treated or has a strain of this bacteria that's antibiotic resistant. So let's talk a little bit about how TB is diagnosed. People are tested in two ways. There's a skin test that's called a PPD test, in which a little bit of material is put under the person's skin to see if they have an immune reaction to it. Now, this test involves 2 visits because the person has to come back to have a healthcare provider read that area that was injected about 2 to 3 days later to see what the reaction looks like. In addition to requiring 2 healthcare visits, this test can also result in false positives if that person was previously vaccinated against TB. The second type of test is a blood test, and that only requires 1 visit, and it doesn't have the issue with false positives after vaccination. So for some people, the blood test is the better choice. With this test, the blood is mixed with a small amount of TB proteins in the lab to see how the immune cells that are in the blood respond to it. In either case, if the person has a positive response to their test, they'll usually be recommended to get a chest X-ray to see whether their lungs have evidence of an active TB infection. Now, if you or somebody you know has been diagnosed with TB, then they may be treated with antibiotics. But there are some nuances to be aware of. First, antibiotic treatment for TB is complex in that it requires using multiple medications over periods of many months, and people can experience side effects from these medications. Some types of TB have also become resistant to antibiotics. For these reasons, the decision to treat is usually made in concert with a public health official or with a healthcare provider that's experienced in treating people with TB. With this in mind, while people with latent TB may benefit from treatment, not all of them are going to be recommended to receive treatment. For those with latent TB who are not treated with antibiotics, about 5 to 10 of every 100 of them will go on to develop active TB. And for people with active TB, they usually are going to be recommended for treatment. But if they don't follow the instructions for use, or if they stop taking this months-long treatment, say they stop early, then they may get sick again, and that increases the chance that the bacteria in their body will become antibiotic resistant. So let's talk about the TB vaccine. A vaccine for TB has been available since the early 1920s. It was developed by Albert Calmette and Camille Guerin, and this relates to why it's called the BCG vaccine, which stands for Bacillus Calmette-Guerin. The vaccine is made by weakening a strain of bacteria that's similar to one that causes TB in people. This strain is one that infects cows, so it's known as Mycobacterium bovis. The cow strain is close enough to the human strain that it can cause protective immunity when it's used in the vaccine. Now, people who get the TB vaccine may have soreness at the injection site, and about 3 of every 10,000 people will develop painful swelling under their arm. Now, as I mentioned, most people in the United States are not recommended to get the TB vaccine, but there are two main groups of people for whom the vaccine is recommended. The first group is children who are themselves negative for TB, but have two other characteristics. First, they have an ongoing exposure to the bacteria, usually because they're living with somebody who has TB that's either untreated or who has a strain that's resistant to antibiotics. And second, they themselves, that is the child, can't take long-term preventive medications. The second group that's recommended to get this vaccine is a subset of healthcare providers. And again, we're not talking about all healthcare providers. These decisions are very individually based, but the individuals who might be considered to get vaccinated are those who work in very specific settings or situations that increase their risk related to TB. For example, maybe they work in a setting where there are high numbers of TB-positive patients that are infected with antibiotic-resistant types of the bacteria. Or second, there might be an ongoing spread of antibiotic-resistant strains in their workplace. A third situation where we might see this is if infection control efforts in that healthcare setting have simply been unsuccessful. But as mentioned, even in healthcare settings and even in high-risk healthcare settings, not every healthcare provider is going to be recommended for vaccination. So now let's turn our attention to some of the questions we receive here at the Vaccine Education Center. Some people wonder if TB is increasing in the United States, why aren't more people recommended to get this vaccine? And the answer here has to do with the vaccine itself. The TB vaccine is very good at protecting against that more severe form of TB in children that we mentioned earlier, called miliary TB. However, it's not as good at protecting against the lung infections that are common in adolescents and adults. Since miliary TB is uncommon in the United States, we don't routinely use this vaccine. In fact, the United States is one of only 2 countries in the world that never routinely used this vaccine, offering us an example of why vaccine policy should be made according to the specific needs of the populations in different settings and situations. Another question we get relates to how we stop the spread of TB in the United States if we aren't routinely using vaccination. And there are 2 things that help keep TB in check in the United States. First, the testing program helps to identify people who are infected with the bacteria. And second, as a result, those with active disease can be treated, and some of those with latent disease are also treated if it seems likely that they'll eventually develop an active infection. Before we finish up with a look at the relative risks and benefits of TB in the vaccine, it is worth mentioning that there's a support group for people with TB and their families. It's called We Are TB, and we have a link to find out more on our tuberculosis webpage at vaccine.chop.edu. So today we talked about the fact that people with TB can often have prolonged cough that is characterized by the production of bloody mucus. We also talked about the fact that people can develop symptoms in other parts of their body depending on where the bacteria replicate. Whereas children don't often have as severe of symptoms as adults, if they get miliary TB, that is a more severe form of the disease, and it's caused because the bacteria are replicating in the lining of the brain. We also talked about the fact that this is the most common cause of death from a single infectious disease around the world, with the exception of the period during the COVID-19 pandemic, when SARS-CoV-2 caused more deaths. While the vaccine itself doesn't cause many side effects, it can cause a painful swelling under the arm in about 3 of every 10,000 vaccinees. And it also isn't the best at protecting against the most common form of TB, which is that infection in the lungs. It is, however, good at preventing the more severe form that children can get, called miliary TB. Given the limitations of the vaccine and the limited spread of this disease in the United States, most people are not recommended to get this vaccine. When our team evaluated the relative risks and benefits, we agreed that for most people in the United States, the benefits of the TB vaccine do not outweigh the risks. However, if you find yourself in a situation in which a public health official or a healthcare provider who is expert in treating TB is recommending that you receive the vaccine, We hope that you'll be prepared to make an informed decision to best protect yourself, because for a small number of people in the United States, vaccination is the safer and better choice. Thank you for listening today.